Good evening, everyone. So today we are going to discuss an obstetric condition. So this obstetric condition we're going to discuss today is called cervical incompetence or cervical insufficiency. So the other name for cervical incompetence is called cervical insufficiency. So what is this cervical incompetence or cervical insufficiency? Okay, so find that a lot of women, they tend to lose their pregnancies mostly in their second trimester, and they really don't know why that happens. So I'm sure with the help of this video today, they will understand why they, they tend to lose their pregnancies mostly in their second trimester, of which is not the only cause of pregnancy losses in second trimester, but this is the most common cause of pregnancy loss, mostly in second trimester. Okay, so let's start. So what is cervical incompetence or cervical insufficiency by definition? So this is just a structural weakening of the cervix and failure to maintain pregnancy, mostly in second trimester. So this is a structural weakening of the cervix and failure to maintain a pregnancy, mostly in second trimester. So that is by definition. So that is what we call cervical insufficiency or cervical incompetence. Okay, of which there are a lot of factors that will predispose a woman into having this cervical incompetence or cervical insufficiency. So what are some of the risk factors that will predispose a woman into having cervical incompetence? So the first risk factor that I'm going to talk about is trauma. Okay, so trauma or previous surgical procedure. Okay, so that can predispose a woman into having a weak cervix that can't withstand the pressure of the pregnancy. So let's say, for example, this woman underwent maybe corn biopsy, or maybe she underwent dilatation and curettage. Okay, so those procedures can weaken the what? The cervix, the structure of the cervix. Hence, that cervix fails to withstand the pressure of the pregnancy. So that is the first thing, trauma. Okay, the other thing also, we have hormonal factors or hormonal imbalance. Under hormonal imbalance, when a woman is pregnant, progesterone and relaxin hormone, they're high. So what happens? If you're going to have too much production of relaxin hormone, so because you know that when this relaxing hormone helps the uterus to relax and contract, at the same time this same hormone relaxing also helps to soften the cervix, or it helps to efface the cervix, or for effacement. Okay, so if you're going to have overproduction of this relaxing hormone, meaning the cervix is going to be over effaced, or it's going to be over softened. Meaning, if it has been over softened, meaning it can't withstand the pressure of the pregnancy. Okay, so that's the second thing. So I've spoken about previous surgical procedures. Okay, so these surgical procedures, they can cause trauma there. Okay, and then the other thing also, I've spoken about hormonal imbalances. As you know, there's too much production of, there's too much progesterone relaxing, and that we're going to have over softening of this of the cervix. Hence, failure to withstand the pressure of the pregnancy. Okay, so that is it. So those are the two first risk factors I've spoken about. The third risk factor for cervical incompetence is what we call infections. Okay, mostly sexually transmitted infections. So those infections, they can, especially this my PID, since it's an ascending infection, it can uh, destroy or the structure of the what of the cervix. Okay, it can damage the structure of the cervix, hence failure to withstand the pressure of the pregnancy. Okay, so that's a third point. The other thing also, multiple pregnancies, bampundu, okay, or sometimes macrosomial babies. Those women wamapapa bana bakulu, multiple pregnancies or macrosomial babies. Due to that, also can weaken the structure of the cervix, hence failure to withstand the pressure of the pregnancy. So those are some of the risk factors for cervical incompetence. Okay. The other thing also, we have what you call connective tissue disorders like Ehlers-Danlos syndrome. Okay, where there is too much production of collagen. So just to maybe give you a little bit of an explanation on that. So this Danlos syndrome mostly is too much production of collagen, and this too much production of collagen is mostly brought about um, by relaxin hormone, the hormone I spoke about that side. So when there's too much relaxin hormone, so this relaxin hormone helps to remodel collagen. So if there's too much relaxin, of course we expect collagen to be too much as well. And this collagen also helps to what? To soften the cervix. So now, if you have too much collagen, the cervix is going to be over softened. Hence, having what? Um, Cervical incompetence, meaning this cervix can't withhold the pregnancy. So those are some of the risk factors for um, cervical incompetence. Okay, so we're going to look at the clinical features. The clinical features, of course, it's the same. So this woman she's going to have painless cervical dilatation. It's mostly painless. Yeah, it's mostly painless. Yeah, and of course, loss of pregnancy is clinical. Loss of pregnancy in their second trimester. Others will be spotting. Okay, so there'll be that cervical dilatation. Others will be spotting like that. They'll start spotting and bleeding. Yeah, but it's mostly mostly non-painless. Yeah, so that's it about the clinical features. And then coming on the investigations. So in the investigations, you do what we call transvaginal ultrasound. Okay, so you do that transvaginal ultrasound where they are going to detect cervical incompetence, if the cervix is weak or not. They're going to do that transvaginal ultrasound scan. Okay, they're going to do a transvaginal ultrasound scan, and of course we have to do my urinalysis. Okay, because we said infection also can predispose a woman into having um, cervical incompetence. So we also have to do urinalysis, RPR, you check for those infections. Okay, yeah, so that's it about the investigations. Yeah, and then after that, we now look at the treatment. So on coming on the treatment for cervical incompetence, and then on the risk factors also, repeated cervical sacrilege, okay, which is a treatment. Repeated cervical sacrilege can predispose a woman also into having cervical incompetence again. So just to make mention of it again. Yeah, so in the treatment, so mostly if this woman she doesn't have an infection, mostly if she doesn't have an infection, you give what we call a prophylactic cervical sacrilege, mostly at 12-14 weeks of gestation age. Yeah, mostly if she doesn't have an infection. But if she has an infection, you want to do cervical sacrilege. You need to make sure that this woman, she's on antibiotics, you treat the infection. That's when you're going to start the woman on cervical sacrilege. So cervical sacrilege, it's a procedure where they need to tie the cervix so that at least it can withstand the pressure of the pregnancy since the structure is weak. So when you tie, so that process of tying and everything, that's what we call cervical sacrilege. Okay, so that's it about cervical incompetence. So from today, any woman that tends to lose their pregnancy, mostly in second trimester, the first thing that has to come, cervical incompetence. Thank you for listening. Please share this video to as many groups as you can so that others can learn. Thank you.